Hello friends, welcome to Creative Medicine. In this lecture, we will learn about.
Hello friends, let us now learn some important points about ethacrinic acid. What is ethacrinic acid? It is a loop diuretic and it is associated with ototoxicity. This ethacrinic acid is used only when other loop diuretics are contraindicated. It is used only when other loop diuretics are contraindicated. For example, it is used in patients with hypersensitivity to furosemide. It is used in patients with hypersensitivity to sulfonamide. If there is hypersensitivity to sulfonamide, it is used. Sulfonamide based loop diuretics, because if there is hypersensitivity to sulfonamide based loop diuretics, like what are the sulfonamide based loop diuretics? Furosemide, bumetanide. You can say that if they are if the patients are contraindicated or hypersensitivity to furosemide or bumetanide, then this is used. So what are the ototoxic manifestations which are seen in ethacrinic acid? They are tinnitus, hearing impairment, deafness, vertigo, and sense of fullness in ears. So these are ototoxic manifestations of ethacrinic acid. Thank you for watching.
Thank you and thank you for watching.